support, Jeff, that actually we are doing a radical change in Dumfries and Galloway. Why? Because we can. We're small enough to do it, and we're large enough to do it with some capacity behind it. But actually, the geography of Dumfries and Galloway doesn't fit to any sort of centralised solution. So we do need to move it forward. Starting with this slide, I think one of the great breakthroughs in the discussion that Jeff and I have had with elected members and members of the Health Board, it's not our community, it's your community. Central answers, the answer of the state provision has failed and will fail, is not sustainable into the future. And it needs to be about how we empower your community. I chose these pictures last night for a purpose. The first one on the left-hand side, that's just talking about loneliness. Particularly in Wigtownshire, a number of our most vulnerable don't have a family around them, won't have a partner. Loneliness, the impact on mental health, the more rapid deterioration of minor illnesses that then leads to the A&E entry point are issues that we can tackle, we can deal with if we view it as part of the whole system and don't wait to the crisis stage to intervene. And that just talks about make a simple phone call, make someone happy. That's actually really, really important, and health professionals will tell you that. On the bottom, absolutely invaluable. My mum receives home care. So at the bottom left, this is a simple home care worker. Is it acceptable that we buy our home care at the lowest possible price, below living wage? It's a political issue. It's not a political issue, it's a moral issue for me. Why? Because that's not been a whole system thinking. So we've ended up rewarding one end of the system by heavy investment in acute, by actually taking money away at the bottom end of the system, and that's what the bill from the Scottish Government's trying to address, and the thrust towards a living wage. Because actually, if my mother is going to depend upon a care worker, I want her paid a decent wage that she can support her family, support the economy, and get from qualifications as well. Up to the top, absolutely invaluable that we spend time. If you listen to the previous assessment, there was not, the first study there was not a time in listening to the family and the individual to assess what the real problem was. We don't create that space. The 12-minute GP consultancy once in a while, the quick interaction at a crisis stage, you bring a different to bear. But that woman would have been known to the system before she arrived in A&E. How do we create the time? And the final one, the answer's not everybody in a nursing outfit, a social worker's badge, etc. The answer to some of the solutions lies in the bottom corner. It's a simple thing about someone in the community helping the person go out. I sat in a case review with an individual, someone with a long-term condition, and actually we were throwing there, well, you can have 20 hours of care, so a stranger will come into your house. I've got a family, I don't need 20 hours care. No, we sat and talked through for several hours. All the person wanted to get their life back was to go back to the bowling club. And actually it was impossible for us to arrange for a taxi, to pay for a taxi, to take them to the bowling club, do a simple health and safety check at the bowling club to look after them one day a week. That actually was the number one thing that person wanted after they came out of hospital with a long-term condition. Right, what simply this shows is what is the challenge. The top line there, the one graphing to the right, is actually the number of over 85s in the next 20 years. 166%, more than doubles. Now that's not all a negative. The vast majority of our over 70s and over 80s don't need any interaction from the state. God, trying to get some state help into my mother is almost impossible. And actually, they need some support perhaps at time. But what we do know is that when you become vulnerable and you're older, you need intensive, heavy investment. That's the bit that's unsustainable. That's not going to change no matter what we do. But what will change is our current system of delivering it is unaffordable, unsustainable, and will fail. It cannot meet that demand. It needs to change. So let's talk about the vision that we have created. We've all agreed between the partners. It's been agreed by the Health Board and the elected members of the Council. It needs to be person-centred. It needs to focus on the individual. We must stop talking about patients or the public in general. We need to talk about what the individuals need to make their lives better. I'd say we're probably further down that agenda in some of the training in the health service than in the council, but certainly as a general public we tend not to talk about individuals. But actually the answers need to be about individuals enabling the tools to do it. The second, it must be provided as close to the whole and community as possible. The answers of shuffling our families, our parents and our friends across the country just because it suits the way that we strategically plan our services is wrong. It doesn't work, and as you saw from the initial case study, even if you move somebody between wards, their health outcomes fall. Imagine moving them around the country. Actually, what we know is, if I've worked in my community, contributed to my community, I deserve to be treated in my community, around my family, my friends in the area. That's what we need to do as a principle for us. That's why we've gone for 4 localities. You recognise the 4 localities. Why doesn't the system recognise that in Dumfries and Galloway there are 4? Actually, if you come to the council, they'll tell you there's 6, but let's not get into that debate. But at least recognise there are 4, and 4 with unique assets that we must exploit and unique challenges. The final is, let's engage the partners better. Proper engagement. During the last few years as budgets have got cut, I would have to say every part of the public sector mistakes looked at the third sector as, well, here's where we can get the job done for nothing, or less money. That's not how you create partnerships. It's not sustainable. And actually, if you look at some of the cost base in the public sector, actually full cost to the third sector saves a fortune. So we need to get into that dialogue. But also the third sector needs to step up to the plate to demonstrate it can be sustainable. It's not single person led in individual communities. And that we can get the quality correct and guarantee it. Patient safety is incredibly important. These are potentially some of our most vulnerable. So we need to build trust at both ends into the system and a framework of assurance that gives us that confidence. And David's quite well progressed in his views around that. I'm sure he'll cover that next. So what's the vision? I use this because it's the simplest way for me to get my head around it. If you see the arrow in the Bull Centre is my mother is 82, she's from Glasgow, she's 4'10", and my God, she has got a view and everything. And one of the views is that she will be carried out of her home where her husband is buried in the back door. You know, not a chance she's leaving her house. So therefore, what we need to do is, our vision is, we must look at what is available to support my mother in her immediate community. And that's not how we sometimes refer to community, as lumbering saying, you loose in Mr. Ra. In your immediate community, the community that you recognise. And in some places in Glasgow, that will be a street. Down here, we need to understand that. What then, as you move out, is available in the wider community, within your locality, the services that we can put together for you? What can be available only in a much wider? And then finally, what can be offered to my mother can only be divided on a regional basis. If, say, it's a long-term condition or something really complex, can only be provided regionally to meet the quality that she does need for that element. But the first bit is what's immediately available in our own community to support it. And I'm the first to say, we're not structured as a council or as a public agencies or the government to work at that level. That's why the empowerment to local teams based in the localities, understanding the communities with the full budget, give them all the money, don't constrain it, let them take those decisions is important. So what next? If we want to do person-centred care, we need to do it once, we need to do it right. Now for those professionals in the room, I recognise, and Jeff clearly recognises, we need to create space at the front end. The idea of I'll have 5 minutes to talk to you. To do proper self-directed support and assessment can take half a day, could take a day. I need to create with Jeff that ability to create that capacity at the front end to get the assessment right and understand the needs and understand the individuals. Professionals talking to vulnerable families at a time of vulnerability takes time to get it right, to really understand the issues and what's available to solve them. Also, it's multidisciplinary coordination. It's one of the first things that Jeff and I did when we started this agenda about a year ago. Said the first thing we need to do is get all the information available to the individual, available to the professionals. You can see it all. Not this is health information you can't see, this is social work information, this is police information when it comes to protection. So what we said is we'll have our information sharing protocol so that each professional can see what they're entitled to see straight off. They don't have to go, and we're working on that, and that will unleash huge potential. All of the information relating to the individual should be available to the team making the decision, or at the crisis point. A huge step forward. Would have been impossible, we'd have told each other 5 years ago. We'd have all hunkered down and called the guardians, etc. The next one, do it close to the home. We recognise the world's not fair. There are inequities in service provision across Dumfries and Galloway as across Scotland. The big hospital is based in Dumfries. There's a smaller one, there's community, but actually it's not equitable. Now, we can't change the world, but we can get a better understanding of what assets are available in the area. So we need to look at that deployment of resources, identify at the first stage where our gaps are, what we can do to deal with that, and plan much better in dealing with some of those inequities. But we also need to build that local capacity. And this is where the third sector, other organisations come into play. We need to build local capacity. There is no point in having a local decision-making team if there are no options to put before you. The only option is to give you 20 hours of someone coming in to put a microwave meal on. If there's no other options, we have to create the capacity, or Jeff will never get the person out of the hospital. That's one of the problems we've got. We don't have options to frontline people of third sector. To meet that person's needs, need to create a market of opportunities in the community, and my view, delivered by the community. That will also create jobs in the community in hard-to-reach areas, particularly in Wigtownshire. The third one is we need to engage partners properly. We need to let go of this control mentality. Through the 60s, 70s, 80s and 90s, the state was the only answer. If it wasn't done by a professional with a now increasingly university qualifications, it couldn't be done at all. The cost of that is horrific. And I'll talk about cost. I've only got a limited amount of money. The cost of us doing it is horrific and unsustainable. But also it's not always the right answer to the needs of the individual. And those frontline professionals here that work with them realise that that prevents simple solutions being provided that probably meet the needs and wants of the person slightly better. But we've grown up that the only way to manage the risk is to do it ourselves. We need to break that. And that's a huge risk for an accountable officer. What if it goes wrong and you're dragged up? I used to work in Westminster. I went to Parliamentary Committee once in 20 years. I go to Parliament almost on a weekly basis to answer for things now. So how do you go over that risk aversion? That you're going to get insulted in a public forum on a weekly basis? You just got to lead through that. We need to deploy all available assets. It's really interesting, we talk about assets, we tend to talk about what I've got, Jeff's got. What's the community got? What about the churches, the vibrant community facilities? What about up-and-coming young single businesses? What about encouraging private sector physiotherapists to take off that local communities can interact with, that we can accredit? That thinking won't come from a centre, it has to come from localities because you know your area well. And finally, I'm a bit surprised because Jeff normally starts his presentation with the first bit. Our system will fail if we do nothing. It will fail. You see in England, England's a couple of years further down the line. It's teetering just now. It will fail. It's unsustainable both in cost, resources, and doesn't meet that huge increase in our elderly population. Not the elderly population, the more vulnerable population. Top-down won't provide the local answers. We would put a bureaucratic assessment process on you that would make it possible to empower third sector organisations or encourage new social enterprises just because we do. You can't help yourself as a public body. But the closer we push that to you that's accountable, the better. You, everybody in the room, has to lead this. You're all leaders within individual parts of your organisations or associations. You've got to lead it. We've got to give confidence to our most vulnerable that the answers, we have the answers, we can deliver this. We will all work together to deliver on that agenda. We can't talk as though it's someone else's problem. Be brave. Please be brave. We have to take risks, and it might not always work. That's hugely difficult for public servants to say, but we have to. Because of the scale of the challenge and the immediacy of the challenge it faces us, we have to be brave, we have to take risks in a managed way. And that's best done close to the front end, people that understand the consequences of it. But we need to support it. And finally, these are our friends, these are our families. And for, 10 years, 15 years' time, it'll be me. So we need to get it right. We have to. We have no option but to get it right. Our friends and our family and our parents will not forgive us if we get this wrong. Because actually we need to change our priorities. Within the council, we have sharpened up the priorities of the elected members. And the other thing we brought in is, where is this system that Jeff's decided going to report to? Yes, it's going to have a board up here. It's going to report to public, open area committees. And so the Wigtown Area Committee is where the reporting and the performance of this will go in public to the public. That's a huge leap forward for this system of care. To help support it, but that accountability, that public, that actually this is so important, we want all the public engaged in the debate. And the final thing is, from today, tell us what you need more to know, or what you might need to make this work. How would we create that capacity in the communities to allow professionals to give different range of options to the person in need, of how their, and I hate the word care, how their enablement might be created when they come out. Because when people leave hospital, people are in decline, they want their lives back and as much as they possibly can get. So therefore, how do we go about creating a framework to allow frontline staff to be able to buy that, commission that, use your words, to create that opportunity for them to get their lives, or as much of it as possible, back for as long as we possibly can. That's what we all joined public service for, particularly those that are working in the NHS. And somehow we've sort of lost that in the huge demand of work that we've got. Our model wants to give it back, but we don't know how that actually will work at the front end. And that's why in the next year, because it's the 1st of April 2016, this has to be in place. We need to start getting the understanding of that, building that framework. And David will probably now go on to tell us how the opportunities for the third sector and working with the third sector and some of the things we need to do to take it forward. I'm passionately committed to it. I have to drive from Dumfries to Ayr once a week to provide some care to my mum. I want an answer to some of the challenges I face, because my mum deserves it, and so does everybody that you work with. So we're committed to do it, but we're open and honest enough to say we don't have all the answers to how we could actually get it working in your communities and for your community.